Hi, I'm Dolly Vasta, and welcome back to Dolly's World. About 5 years ago, I had a guest on my show, and his name was Dr. Edward Magaziner Jr. He was a pain management specialist, and we talked about prolotherapy, which was fairly new then. And at the end of the show, I said to him, what do you see in the next 5 to 10 years? And this is what he said to me, so I get it correct. He said that he predicted, rather, that the future for orthopedic treatment would be all about regeneration of the use of stem cells and growth factors. And today, Dr. Magaziner is with me again. It's 5 years later, and he has a new procedure that he has been doing, which I think really came from the prolotherapy that we talked about last time. So Ed, it's good to have you on the show.
Good to see you again, Dolly.
Yeah, and you are a specialist. You have an office up in North Brunswick,
yes,
on Route 27.
Yes.
And you specialize primarily in spine, sports medicine?
Yes.
What else?
Orthopedic medicine, non-operative orthopedic medicine. We take care of people that have any kind of pain problem or musculoskeletal problem, and we like to see people that are just short of surgery. In other words, they've gotten some basic conservative care, the physical therapy or chiropractic, and when they're not better, they're not happy. I like to see these people, and there's a whole host of new treatments that are available to help them short of getting an operation, and that's what I specialize in. We take care of people that have disc problems in the spine, neck, back problems, sprains and strains. But one of the things we're going to be talking about today is an exciting new treatment to help take care of arthritis and tendinitis and other kind of muscle and tendon ligament problems.
There are problems too. Arthritis is so hard to manage.
Yes.
And everyone has it, that does have it, seems to have it either very strong or it comes and goes. And this seems to me to be a treatment, and from the people that we talked to yesterday, that really helped. So tell me a little bit about the treatment. It's called PRP.
Right, that's the initials for platelet-rich plasma matrix tissue grafting. Basically, you want me to tell you about the treatment? Yeah.
Yes.
It's a treatment where we're using the patient's own blood, and we're extracting the growth factors and stem cells and other undifferentiated cells which cause healing in the body out of the blood, and then we're transplanting them to the site of injury or arthritis to help get rid of their pain and actually heal the part, as opposed to just throwing cortisone at it or something else. You know, I've been in practice for 20 years, and you know, I started like everybody else with cortisone injections and just doing the standard things. For arthritis, a lot of people out there might have heard about the rooster comb injections, where they're injecting Synvisc or Hyligan. You hear about that on television, and I did that for a while, and that helps, you know, some patients. But then I progressed, you know, as science progressed, I progressed along with it, and then we did the prolotherapy, which we'll probably talk about later. But now the next stage, and we're in not the 20th century now, we're in the 21st century, and it's really all about repair and regeneration. If you look on the internet in any area of medicine now, and you look at the pharmaceutical industry and what they're researching, they're all looking at how to fix and repair things, from the heart to the liver, to making new organs. And in orthopedics and musculoskeletal medicine, the state of the art now is to help fix arthritis, get rid of tendon injuries and things like that, and that's what this new treatment's all about.
Let's backtrack for a minute, though, to prolotherapy, because that actually came first.
Correct.
And you have patients who did have it, and maybe it didn't work as well on them as it did on others. And so you suggested this, which is like the next step up. The
next step up, right. Prolotherapy, also known as regeneration injection therapy, has been around pretty much for about 50 years.
What's the theory of that, you know, simply?
Very simply is the body has the capacity and ability to heal itself. If you cut yourself, if you break a bone, the body, goes in there and it heals it. And what prolotherapy does is it acts like a magnet, such that you create a little inflammation and it attracts the growth factors to come into the area by that inflammation and cause healing to occur. It works exactly the same as if someone went to a plastic surgeon, for example, and they had a laser peel or a chemical peel, and they burned their face with a laser, or they put a little chemical acid on their face, not enough to hurt them, but just enough to make it red. And lo and behold, they get new collagen on their face, and the wrinkles go away, and things like that. So we know in medicine that creating inflammation, a good inflammation, attracts the blood to the area, and thus the growth factors come along with it, and that's how prolotherapy works. So we've been able to help thousands of patients through the year, with the prolotherapy. But there are some people with advanced arthritis and real tendon tears and capsular tears of the shoulder, we'll probably talk about later, that the prolotherapy fell short. So that's why I stepped it up with this new treatment, and been very satisfied with the results that we're getting.
There aren't many of you, though, in the country who do this procedure.
That's true.
How many?
Now there's probably closer to 20 or 30. When I started out doing this, I was one of 3 people in the country. I came upon this on my own. I was traveling in Europe, and the Europeans were using serum injections for cosmetic purposes to help build collagen in various parts, on the skin, for example. And I said, wow, maybe that would be good for for the treatment of arthritis or something or other. Then when I came back to this country, I found out there was actually an FDA-approved machine that the orthopedic surgeons and the plastic surgeons were using to get this platelet-rich plasma that we're going to be talking about, and they would mix it with bone to make the bone heal faster. And that was exactly what I needed, and we started using that for repair of tendon problems and ligament problems and joint problems and things like that. And then as I researched it more, I found that there were a few of us around the country that were actually doing the same thing, and there were a few papers that were starting to come out on it. And we're going back now around 2001, 2002, and now the literature is just full of this kind of new stuff that's going on.
You are going to be presenting your work next month at the American College of Orthopedic Medicine.
Yes.
It's an honor, isn't it?
I'm very excited about that, yes.
What do you hope from that?
Well, I want to get the word out there. I think it's an important treatment because what I've seen is people that been told they need a total knee replacement or a total hip replacement, or maybe it was too early for them to go for one. They got the arthritis 10, 15 years too early. And I've been finding that we can get rid of their pain in 7 visits and get their function back, the way it was before they were crippled with the arthritis. And I'm hoping to get the word out so more people can do it around the country and help more people. So I think it's going to change the way we treat musculotendinous problems and arthritic problems around the country.
All right, so why don't we start? We did
Sure.
a lot of taping yesterday with quite a few of your patients. I had a chance to talk to them about their feelings about the procedure, but we watched the procedure and Dave taped it. So why don't we talk it through now? It started with they had blood taken from them.
Correct.
Go from there. And then it's put in that.
We have a special centrifuge that comes from the company. And what it does is it works at different speeds to be able to separate the platelets out of the red blood cells. The blood has lots of different fractions in it. And we're able to get the fraction that carries the stem cells, the platelets, the growth factors, and the healing cells. That the blood actually, when it comes to an area that's been injured, it sits in that area and and causes that body part to heal. So with this centrifuge, we're able to extract out the most important part and then use that in the grafting technique. This area in here? This area in here?
Yep.
In through here?
All through there.
How about over here?
Yes.
In through
That's
here?
another good one. Yeah.
Okay, so we're going to do the thumb, and we're going to do the outer portion of the wrist there.
Well, my experience has been a number of sports injuries, a number of surgical procedures that didn't turn out as well as I had hoped. And as time went on, I actually became more and more somewhat disabled from the chronic pain, that I couldn't carry out a lot of what activities that I used to do regularly on a daily basis as a chiropractic physician. But when I learned about PRP, it was something so new and so different and so interesting that I had to learn more about it, because the thought of actually being able to regenerate tissue that had been torn, that had been damaged, that had been worn away from athletic injury, from wear and tear, and to have that actual possibility be there to actually regenerate the tissue and bring life back into a joint was certainly at least a fascinating option. And when I learned about it, and as I said, I learned about Dr. Magaziner doing it, I certainly said that this is something I have got to try. And that's how we began with PRP. And I would say that
How was your knee?
my knee is 90 to 95% recovered from better than it was when I started 2.5 years ago.
We use a fluoroscopic x-ray machine where it measures inside of the body in 360 degrees. It gives us pictures in any direction we like. He has some mild arthritis in the wrist, and we start by marking the spots that we want to inject. We clean the wrist up, and we'll numb him up a little bit. Give me the cold spray, please. We use this so it doesn't hurt so much. You okay, Mr. Cook?
Yep.
Okay, now we inject the PRP into the wrist, the platelet-rich plasma. Okay, that's it for the wrist. Once we numbed him up with the cold spray and the anesthetic with that tiny little skinny needle, he was pretty numb through the whole procedure. Didn't feel almost anything. Would you say?
True.
Would you say?
I'm 71 years old.
And what has been the problem that you've had? Your knee?
Well, I broke my ankle two years ago. And then after that, my knees were starting to give me a little problem.
So here we're doing a knee. We mark out our entry sites. We numb up the knee a little bit. Does that hurt much?
I don't feel it.
You didn't feel it? Does that hurt you?
No. I'm fine.
What I'm going to show in this picture is that with the x-ray and the fluoroscope, we can direct the platelet-rich plasma exactly to where the arthritis is worst and treat that specifically. I mean, how many people out there have arthritis in their knees and they need to go to total knee replacements? When a treatment like this can buy them another 8-10 years or more for their knees, you know? Or if you get someone early enough, you might be able to prevent them from getting a knee replacement altogether.
I feel there's always a better way than cutting all the time. I'm sorry. Once they cut me and put metal and what have you inside my bones, if that doesn't work, what are they going to do next? So I want to extend myself and take every opportunity I have to try all the natural procedures or new procedures that are going to help, that are beneficial without cut all the time.
It's like leaps and bounds from, yeah, the difference, yeah.
Were you curtailed a lot in your activities before you started this?
Yeah, I couldn't even like lift a glass of water. It would hurt to type. I just start using the mouse on the other side. You know, every little thing, you know, that I would do with this arm hurt.
Okay, we're applying some sterile ultrasound gel. And what we're using here is the same type of ultrasound machine that is used for OBGYN looking at babies, only we're using this now for musculoskeletal. And in this situation now, we're looking at the outer portion of her elbow, and that's the screen. And that is the tendon that she has a problem with, right in there. Now this is the tendon that we're going to be injecting. I'll put an arrow on it. Okay, so we're going to numb it up a little bit. You're going to feel a little pinprick. In the screen, there's like a little wobble effect. That's the needle. I think you can see the tip of the needle. It's a beautiful picture going right down onto the elbow. Now we're injecting. You're seeing the swelling and the movement. That's the whiteness over there. That's the platelet-rich plasma going in. And going all around. You can see how it's turning white there. That's the PRP going into the area where the tendon hits the bone there. I'll just show you the movement of the needle so you can see where it is again. It's coming in from that angle now. And then we're injecting it down along the right-hand side of the screen. Now we're going to move up a little bit. And we'll inject it a little bit higher. The needle, I think you can see coming down on the right-hand side of the screen. It's at about, say, 1 o'clock. Can you see the wiggle? Yeah. And now we're going down, and it's hitting the tendon right there. And now we're injecting. You can see the medicine going in just because of all that movement that's there. That's the medicine going in, and that medicine carries the growth factors to help heal the tendon there.
These injections, the sites could be the spine, the shoulders, the elbows, wrist and hand, hips and pelvis, knee, lower leg, ankle and foot, and the arthritic joints. So you haven't missed too many parts of the body, have you, with them?
Well, literally, it is the healing factors that the body uses to heal itself. That's the beauty of it. I mean, it has stem cells in it, it has all the growth factors in it, and that's what the body uses to fix itself. And that's the beauty of the whole treatment. You don't need to go to a drug company and buy anything expensive. It's in your own body. The only thing is we concentrate it down at a 1 to 8, where it was diluted before. Now we can concentrate it, and then it can act where it needs to act to help to repair something.
Now this works on anyone, young or old.
I would say if they have a good amount of platelet supply and their immune system is in pretty good shape, it pretty much works with just about anybody. We've done people as young as 9 or 10 years old to 90 years old. You can use this on children. That's the beauty of it. There's no steroids involved. If you have someone that has an injury, even at a young age, you're just using their own blood serum in a concentrated form to place it for natural healing to occur.
The other part that I find amazing, and we were talking about this earlier, is that they are your own stem cells. There is no moral issue about it.
Correct.
You don't have to get permission to use an embryonic stem cell. Do you feel that this works as well as an embryonic?
For our purposes, absolutely. I mean, certainly if you want to regenerate a new liver or something like that, then there might be some other stem cells out there. But as science evolves, we're finding that we don't need the embryonic stem cells, that the scientists are discovering ways that they can get stem cells from your skin, or they can get stem cells from the fat. There's extraction methods from the fat to get stem cells. And of course, there's bone marrow stem cells, which are also good. It really depends on what body part you're trying to treat. But for the most part, bone, muscle, ligament, tendon, even heart muscle, you can use these stem cells and growth factors that we're talking about. In fact, there's a treatment out there that they're using this same tissue that we're using in some centers, in investigational purposes. They're actually injecting it into the heart to help regenerate heart muscle in people that have heart attacks or circulatory problems in the heart. They're also injecting this into arteries in the extremities for people that have, let's say, diabetes or peripheral vascular disease to help regenerate new blood vessels in the extremities. So this what we're talking about is not an alternative type of treatment. This is really cutting edge, and I think the future of medicine.
Not only that your patients, no one is, as I said before, it's local anesthetic, and no one is knocked out, and they chat with you, and I know you constantly ask people, are you all right? Are you all right? And they answer you, or they kid with you. There was a young lady who played the guitar and the percussion, and she hadn't been able to play in a long time.
Yeah.
And she was so excited about being able to perform again that it was fun to watch her face when she talked.
Yeah. That's what gets me through my day, actually. Having to deal with the insurance companies always is the tough part, but being able to help people and turn their life around, take away their pain and get their life back, whatever they like to do, whether they're a policeman, being able to get back to work, or whether they're a musician or a dancer or a runner, where they couldn't do what they enjoyed to do. With some of these treatments, we're actually able to erase the problem and get their life back. So that, for me, is very rewarding.
I was in a lot of pain, so I went to go get an MRI of my hip, because all I would do is limp all the time. And the doctor that I went to told me that I needed a hip yesterday, that I had bone on bone. So I called up Dr. Magaziner, and I says, could you help me out? And he says that there's this procedure that he could try. He has to see my MRI first. And if it looks good, he could probably get me 5 to 10 years before I would need a new hip. So I says I was willing to try and go see what it was like. I'm able to exercise again. I go on the treadmill. I do an elliptical cycle. I own a laundromat, and I have to jump over washing machines to get to the drains and stuff, and before I wasn't able to do that, and I'm able to do that pain-free now.
I had tendonitis in both elbows. In this one, it was on the outside, and on the right one, it was on the inside, and the pain was very severe. So I had tried everything else, and my last alternative was surgery, which I really didn't look forward to. And then I heard from a friend here in the library about Dr. Magaziner's treatment. After about 5 or 6 treatments, both elbows started feeling much better.
So what would you say your pain level was in the beginning?
My pain level, probably in one arm, in my left arm, was around 7 or 8, and in my right was like a 10.
And where did they drop to?
I feel tremendous. I can lift weights now, and I can lift my kids and play with my dog and do all the things that I used to do.
So how many treatments would the average person get, or is it case per case? What is the least number, or maybe the maximum?
The least number, I would say, is 4, and the maximum that we're doing in one series would be up to 7. And then after that, someone might come for maintenance once a year, for example. And if we're treating a bad arthritis of the knee or the hip, once we're able to get their pain level down to the range that they're happy with, then I might have them come back and just give a booster treatment once a year or something like that, depending on what they need.
I asked you 5 years ago what you saw in the future, so I'm going to ask you again. What do you see for the future now? Where will this go from here?
Well, we already have the growth factors, and now we're working on more concentrated ways to get stem cells. And once we have that, we'll be able to do better transplants of the stem cells, growth factors together. So I think that we're already there in the future. Whether we're going to talk about regenerating new joints in a test tube and transplanting, I can't say that. But I think that as this technology gets better, maybe we'll actually be able to see some reversal of arthritis and things like that going on. I mean, there's a company out there that I've been watching that makes cartilage grafts, and the orthopedic surgeon, for example, someday soon will be able to do an arthroscopic procedure and just put on a whole new layer of cartilage, in one procedure.
I'm waiting for that one.
It's going to happen.
It's going to happen.
So we're all part of a piece of the puzzle. Disc replacement. We're working on technology now where we'll be able to repopulate the disc with a new nucleus and repair the annulus. So people that have herniated discs and degenerated discs will be able to repair the inside of the disc. So
this has been the fastest half hour I've been through in a long time. Listen, I thank
Dolly,
you.
thanks for inviting me
Thank you
down.
so much.
Thank you.
Thank you for being you and caring and working with so many people. To all of you out there, this is kind of my retirement show. It's the last show of my series that I'm going to be doing. I won't be gone totally, but I will be gone every month. And so this has meant a lot to me to do this show. But this is a wonderful, wonderful little pamphlet, and they are available. It tells you all about PRP, and it's in very simple language so anyone can understand it. And all you have to do is call the doctor's office, and he will send it out to you, and we'll scroll under his telephone number of his office. He is a wonderful guy and has done a lot for our family. So I thank him, and I thank all of you out there for watching all these years. Take care, and I'll see you soon.